available, because they were just funneling them out to primary care. It's like, you need to keep the patients in the practice.
Absolutely.
We're here.
You're here, take a breath.
Yeah. So are we waiting on anyone else?
Yes, sir.
Just me, all right, very good. Well, let's call to order our November 18th meeting. First order of business is the approval of minutes. So I'll give everyone a chance to skim over those. I'll make the motion to approve.
Second.
All in favor? Opposed? Minutes are approved. Division reports. I don't see any division members here, so, okay. All right.
So when do we get the results back on mosquitoes? They did a mosquito trapping.
Josh, one of our new employees, he trapped all summer. We didn't have any positives of anything worrisome. So I don't know how many days it takes. And they don't actually send the results. He just gets an email that the results are in a system and he logs in and looks at them, but we had no concerns. There was a little pool over by Gas City early in the year.
Wasn't there avian or something? No, but there was something. Somebody told me that there had.
There were West Nile.
West Nile, sorry, yes.
Over by Gas City early in the year.
Yes.
But it never.
Right, I knew there was something. I was trying to figure it out, yeah.
So it never turned into any human cases?
No.
I'm not aware of any veterinary cases either. Okay. On the nursing division report, it says assisted school nurses EpiPen order delivery. Do we help provide the schools with EpiPens?
Dr. Woods writes the prescription and then we place the order and deliver them.
Very good.
Lori has just been phenomenal at the work she's done as a school health liaison.
I tell you, the list looks phenomenal. I'm looking at that. Wow.
It's a lot of stuff.
Wow.
Kudos to her.
Yeah.
She really loves it. She loves her job.
Which is amazing, yeah. Okay.
I was discouraged to see 3 additional suicides. Dr. Woods and I have talked about the requests that go through our office about speakers and community presentations, and I didn't know if there's ever a place, as we're looking at funding, to even pour into local community mental health organizations as far as sponsoring speakers for suicide prevention. I was thinking churches, community events, as we're tracking these numbers, thinking in fatality, how often people will post on Facebook before they die by suicide. I don't know. As I saw that, I was just thinking of this board and what options we have as far as continued community education.
And there is some funding if you wanted to come up with specific ideas.
Yeah, I know that finding a speaker, not you on this, something else, but other speakers that are qualified to speak to that in public settings would be wonderful. Have a little speakers bureau for that.
Have we ever looked at any work with DCS with foster parents or families? I can share that my family was recently impacted by suicide. I just lost a niece 2 weeks ago. And she was adopted by my sister. And, I think of all of the children that have come in and out of our family over the years, with my sister being involved with DCS as a foster parent, and equipping foster parents with tools and resources for mental health challenges in children who come from previous abuse, because as they age, they don't always know how to cope. And that was this poor girl's
Did you see the movie that was out, Possum Run movie, about a church down in Texas, in Possum Run, Texas, that did a whole thing with foster children and adopted a whole bunch. It was really and it really was pretty real. It was powerful and shout of something. But it was a good one about foster care and the trauma the kids have. Some of that, yeah.
Well, in this example, this young lady would not have gone to someone like you, Dr. Hoaxman, because her perception was, they're going to put me in an institution. And she said, they're going to tell me I'm crazy. She already felt judged. She wouldn't seek help even, I mean, it took us probably almost 2 years to even get her to get to a clinician, and then she was on a good regimen but was still having manic episodes. And so, we thought she was doing really well. And this happened. So I don't know if that's an outlet we've ever explored, but that's just, how my family was impacted through that as a potential, source of inlet for families and children who are needing services that maybe aren't going to come in other ways.
Foster care agencies regularly reach out as far as needing speakers on whether it's suicide, substance use, trauma. I've spoken at some of those. Certainly, as mental health systems are taxed, I still can't help but think this is a priority. I do feel like we could find the speakers. I now have a department, and so that's helpful. And so I feel like that could be something that could be used. I've spoken at the library a number of times on topics such as this. Anyway. This just in particular grieved me, and so I just thought, I feel like if we could support our community in this way, if there was a way to do that, and again, to support the individuals in the community who are already doing this work, but just in a more public way, and sponsoring some community events to just suicide awareness.
And I know, Tara, correct me if I'm wrong, but even when we were trying to use HFI monies for the maternal mental health, we got a little bit of pushback because they said there's a whole different funding for mental health. And we tied it into substance abuse and our infant mortality, and we're able to get it swung to spend the money on the maternal mental health. But our regional director was really like, you're kind of crossing the line from what this money's meant for. So,
If it can be tied to substance use, is there a way to do that? Just knowing the high rates of comorbidity with substance use. And again, we see that certainly in fatality with the substance use. Often even with our suicide deaths, we're seeing high rates of substance use with them. I don't think that's a big leap by any means.
we could talk to Mike.
Yeah,
and
it's
just
absolutely a
ask.
conversation.
Yeah, we could talk to the regional directors and see.
Can you shoot me an email with your thoughts, and I will forward them to him and tell him it's a conversation we'd like to have and see where it goes.
Because our presence on this team, the SORF team, is a part of what they want us to be doing, so it makes sense it's an action out of that meeting.
I feel confident if this is something the board would feel would be helpful, I feel confident I could find the speakers and certainly would be willing to be a part of that. Couldn't commit to that regularly, but just feel passionately about that and feel a level of discouragement as we continue to see these high numbers. And we just had fatality again today and reviewed. We're just regularly reviewing these
The
suicide
meeting they're
deaths.
speaking of is suicide and overdose fatality review. So every suicide or overdose is reviewed by a panel of mental health providers, law enforcement, a whole group of people that could have touched, and just a conversation about what could have been done differently.
So we meet every month and review 3 cases, and we are, I don't know how far behind.
Spring of 23, I think, is where we're at right now.
So it's, and just what we could have missed. And so it's just sickening the amounts. And as you review that, just this somber feeling of it, you know, as you review people's loved ones. In this, Jen, we were just reviewing Grant County, and suicide after suicide, overdose after overdose. Just sobering.
Are you guys familiar, because I've just been introduced to a program called In a Pinch that exists for providing kits for foster families in a pinch when they're taking a kid in on kind of an emergency basis. Didn't know if that would be a way to segue in some of that information in to help those
Is that
families.
a program by the state or by?
You know, I don't know. And the only reason I know about it is they're apparently looking for space. The address that's listed on their website is 114 West 4th Street in Marion. They were looking for space and approached my church, and that's how I became aware of them, didn't know of them at all.
More like a respite, kind of.
Not a respite thing, it's kind of an emergency supply thing. So
it's supply
providing
thing.
like
Like
supply
car
things.
seats, clothes.
Right,
like,
you know, hygiene supplies,
A lot of
diapers,
these babies
shoes.
come with no car seats. I mean, I
Yeah.
can't tell you how many times my sister stopped on the way to the office and bought a car seat to take a kid home.
Yeah,
Because they don't have
so,
anything.
yeah, this agency exists to plug that gap, I guess.
It's a local agency. I think I know who's working it.
Yeah, hang on, I'm gonna,
Foster parents are required to do so many hours of engagement. And so my sister used to go to foster parent meetings because they're required to do those. So, I mean, the county would have that. They were out of Madison County, so it's, I'm sure, a little different, but it's still close and similar.
it was just a new service I wasn't aware that was available and dovetails into the whole foster system, so.
And I'm happy to, Andrea Wilson is their director. I'm happy to also talk with her and see what's available as far as our, you know, our local foster parents, if that would be helpful.
I have some of the foster kids in Thursday night access group, younger ones, and they're complicated. They need help. They really are. Yeah, one day they'll be just like everything's fine, and the next day they're destroying things. So, yeah.
Any further discussion on our division reports? All right,
Can we get a motion to accept them into rehab?
sorry.
So moved.
Second.
Okay, all in favor?
Aye.
Okay, opposed? We will accept the division reports into records. Next order of business is health officer comments.
Yeah, the main thing that's been going on recently is just finalizing where our HFI monies will be going for next year. We're continuing the relationship with Bridges to Health to support the peer recovery program. We're working on coordinating some funds to support the smoking cessation smoking prevention person that's employed by Marion Health. We're continuing our relationship with Purdue Extension for the Dining with Diabetes classes and other classes that will be offered that meet our key performance indicators. And they're spread throughout the community in various sites like housing communities and all. And then we did have 4 clinicians complete the maternal mental health 2-day live virtual training, and the reviews from that were amazing, and they just had wonderful experience with what they learned. We've also had a handful, I don't have the exact number of clinicians, primary care clinicians, NPs and MDs and DOs and doctors and nurse practitioners finish the diabesity, which is talking about the trajectory of diabetes and obesity as a disease continuum and how to approach that. And they have given very good feedback on that has helped them in their current day practice in our community. So we have to get those submitted to the state when the,
Just with, December 6th, actually, I need those numbers by then.
yeah, so that's primarily what's been happening.
Okay, you meant, I couldn't quite hear what's happening December 6th.
We have to have those reports submitted to the state by December 6th.
okay.
Just the numbers.
Okay. How do you feel community attendance, community support has been for the programs that we've started?
Well, the walking program was a bust. It just didn't happen. And part of it was we had anticipated that the facilities would be promoting it, that, hey, we've got this, you can come walk. But they did not. They were thinking that the health department would be advertising their program. So there was miscommunication in that. So we're not repeating that. What we're trying to do is come alongside programs that are staffed and are working and supporting them rather than trying to invent a new program when we don't have the department and the health department, we don't have the staffing in the health department to support things. So we're coming alongside other agencies. So
Who had the walking programs?
the Y and the Wellness Center.
And what were they supposed to do?
We were just gonna, anybody that was willing, wanted to come and walk, we would pay the
We were
cost.
gonna pay the bill.
Because it was $5 a month at the Y and it was $1 a day at the Wellness Center. So it just felt like an easy way to help people meet that need for exercise, but it just, I didn't pay out a single dollar to either place, so. Now it was suggested that maybe we should have provided vouchers to primary care providers that they could give to patients. That was just recently
Yeah, we
suggested,
actually,
so.
when Dr. Weaver was here, we kind of talked through that a bit. And they had some good ideas for how this has worked in other counties, but
I know there's lots of
2025,
people, lots of people walk at the wellness center.
yeah.
And my insurance pays for it, so I don't have to pay anything for it.
And maybe that's part of the reason we didn't get any takers.
And what's the other walking one? Silver Sneakers? They get paid by Silver Sneakers, I mean, certain ones do, so, yeah. But I think handing them out so that they have a coupon to go and walk 5 times or something. And if you did a tracking and who's walked the most in a month and do a little kudos or something, I mean, I'm a walker.
So we
Yes,
are
yeah.
in early discussion about maybe paying for an employee of each of those places, and we haven't even approached them yet. It's very early discussions. There's a fall prevention class that the state puts on where
Yeah.
it's just exercise. And we did discuss if we would pay for their employees to get that training, maybe them offering some classes that we could come along and fund. But that's way down the road. It's early stage talking. So.
I think if winter time is when you would get the walkers. Because they're building, people are going in because it's darker at night, you can't walk at night, so that, so that's when walking, people can walk outside if they're going to walk, so during the summer, but come winter now, it picks up at the wellness center at least. Yeah, and it's nicely padded, and they do offer, I took a fall prevention class there, but it was through an OT doctoral student who was doing research.
Gotcha.
And the senior center has a fall prevention, something going on by somebody PT students or something. So, working maybe with the senior center with some of this, because the senior center, I mean, we all need the fall prevention and the getting out during the day, mental health even, it would improve, so combine it.
The Silver Sneakers program has been something that's been successful, but they and the Y nationally are not together. So the Silver Sneakers is actually through,
Wellness,
maybe wellness, but
they
most of
took it, I think.
from the gym at the mall.
Planet
Fitness.
Oh,
There's the Y is connected with another, program depending on, again, for seniors and depending on which, insurance program. You don't have to do, Silver Sneakers is a Anthem product, and what the Y is currently doing was something else. So there's different things, and so my point simply is to get walkers, you're talking about people who would otherwise have to pay, because it takes hardly any motivation at all, because your insurance will cover you somewhere if you're a senior.
Right.
So you're talking about that group of 30-year-olds to 64-year-olds. And my other comment would be that historically would be nice to be able to, everybody has an excuse, and so to be able to say, well, here, this will cover it as a family doc, that there is some wisdom in that. Now, again, if I'm having to go through all those gymnastics, I've got an excuse why they can't get to wherever we're trying to go also. So all I'm saying is that it's there are opportunities, but you're talking about that group of people that are less than 64 for the most part.
Yeah.
No, I think that's all I have.
Okay. Have you been able to find space for all of the new employees, and is that working okay?
Have, yes.
Okay.
Yeah. Or that some of them are on top of each other, but it's all right.
Okay. As long as the group gets along, yeah.
Yep, so far so good.
Cool. Very good. Very good. Okay, we have no old business listed on the agenda.
I'm gonna go print the schedule for 2024. You guys.
Okay.
I mean 2025, sorry.
I'm not ready for 25 either.
I think we're the 4th Monday, January, March. May it's the 3rd because of Labor Day, July, September, and then November is the 3rd Monday because of Thanksgiving. So those are going to be the dates we're looking at. 4th.
That's what she said.
which one?
She's bringing it, but 4th as a rule, except in May when it's Memorial Day and in November when it's Thanksgiving week. So she'll bring a list.
So the movie was Sound of Hope, Story of Possum Trot. And like the churches in the community, they all started adopting lots. And eventually, it was based on a true story, the social worker had no children for foster care. It was quite phenomenal. It but there were really hard parts to it too.
Yeah.
Sound of Hope, Story of Possum Trot. I just remember Possum Trot because it's such an odd name for a
Oh,
town.
you have it? Okay, thank you. Sorry about that. I'll be sorry.
Do you ever send out meeting invites for with Google Calendar at all for everybody? So it populates the calendar?
I can.
And that would just be another option if these get approved, yeah.
I agree.
I don't like Google Calendar. My phone doesn't like Google
Some
Calendar.
people don't. I also have a different calendar too, so.
Yeah,
it depends
no,
on
my
who's
daughter-in-law
sending it.
sends me stuff on Google Calendar, and
Actually
it either doesn't populate or it sends me 15 invites instead of, one.
To do, that these are the meeting dates that you guys agree on. Yeah, we just need a motion.
Any problems with the 24th of March as far as spring break for
It is
people?
spring break for us, but call in.
Oh, that's right.
Need be.
Spring break anymore.
I still got a couple kiddos.
September 22.
I won't be able to do May 19, but
We're here.
The next week is Memorial Day,
Yeah.
so.
And I might be gone again in September.
Okay, I'll give you an excuse to absence.
Need your motion to approve the, any other concerns on the dates, or feel like we could have a quorum at those meetings?
I don't think so.
I'll make a motion to approve the proposed 2025 meeting dates.
All in favor?
Aye.
Opposed? Okay, we will accept the 2025 Health Board meeting dates.
Okay, so we're adding another agenda item, B, under new business. It's just an environmental / public health concern that may become an issue that Dr. Woods and David would like to share a little bit about.
Yeah, we have an issue, and Mr. Glickfeld's going to need to maybe speak more to it with a local venue that there was a report filed a couple months ago that they had raw sewage leaking into a creek that was going into the Mississinawa. And they were asked to do some remedies, and I think it was done for a short period of time, but then the remedies failed. And David's been in dialogue with the owner, writer, an email conversation.
I can't hear you, I'm sorry.
I'm talking about the Covenant Place.
Yes, what about it?
You've been in conversation with the owner.
Correct.
Okay. With some things that we need to have happen. Did you get any feedback from?
Well, I want to start with a basic premise
Yeah.
that this could be an ongoing legal matter, and it's generally a very bad idea to discuss ongoing legal matters in a public setting.
Okay.
Anything you say could be used to get you in court.
Okay.
You could come in and be ordered to come in and ask, why did you say this? Why did you take this stance? So generally, the law provides us to do this in executive session.
Okay.
So I'll be happy to discuss it, but I think it's a very bad idea to do it. We've been threatened with lawsuits on this. We're threatening this individual with a lawsuit. And as a normal rule, you don't talk about that in public meetings. I know nobody's here, but this is being broadcast, so
Sure, yeah.
I don't think it's a good idea to discuss this issue. I'll be happy to do it in executive session, and the law provides us the opportunity to do so.
Which we have to advertise first,
You
right?
need to advertise
Just say, yeah,
executive
we
session, that's
can't.
correct.
So we can't tonight.
Okay.
Okay.
But I can say we are trying to resolve this issue, and this gentleman has sent me pictures of pumps he has purchased. He's got contracts in place to try to get this done. On the health department's request, I sent a letter explaining, outlining what the health department wanted, an email, and that email was sent. I've not heard anything back. I think that was probably Friday when that was sent.
I didn't want you to hear the Chronicle Tribune, so, there's an issue.
Facebook.
Yeah.
Or
Or
Facebook.
Facebook, yeah.
That's how I learned today that the health department had closed a gas station, was Dr. Woods saw it on Facebook and asked me about it.
If this was a closed matter, it'd be one thing to discuss it, but it's ongoing.
Understood.
So if you hear anything, rest assured, we're on it.
Okay.
Gotcha.
And yeah, please let us know if at any point you feel we do need to convene.
Sure, it's very complicated. You have an individual who has a property that has a lift station on it, which is different in unincorporated county. Normally, people have septic systems. But I guess it was close enough at some point that waste was pumped to the city a mile away or whatever, and that's what the lift station does. Then you've got foster care homes at play here, and you have some pastor homes. So you order these homes closed, all of a sudden you have children who, I mean, it's very complicated. It's not an easy situation at all.
Understood. Okay, any further? Unless there's other business at hand, I would entertain a motion to adjourn.
So move.
Second.
Okay, all in favor?
Aye.
Okay, we shall adjourn.
Hey, that was quick.
Yeah. It's the post-COVID era.
No,
It's ish.
no. It'd be nice to be able to say that.
No, I know, it's
Thank you, everyone. Have a good evening. He's okay. He's a sick guy.
I knew nothing about Joe until, sometimes.
Yes, and you've been an eye wound.
Yes,
Yes.
Tara, you showed Dr. Woods the email. The first email.
She does, and she saw the email that we,
The one where he outlines what he's gonna do to fix it.
oh, he forwarded her.
Yeah, so Renee.
That wasn't the one where he was outlining what he was gonna
Here it
do.
is if you guys want. I Jim did it.
We were very
You
sad.
guys might want to read this.
They go to Taylor, but now that Ian is there, I don't believe, and Tim, of course, is
Well,
there.
Tim was there, so I
Yeah.
could have, I predicted that.
Yeah.
And I don't even work, I retired in
I'll go ahead and read that.
December 20.
Oh, nice.
So, yeah, so I
I sent him the email.
Yes. Yeah,
We
my
literally
son-
begged her to stay on board.
Oh, yes.
Literally.
Yes, I am sure. My son.
when is my term up?
Oh, I don't know, Tara would know.
Well, good to meet you and talk with you.
Yes, I was in a couple meetings with you, but I never was able to say anything.
Yes,
So-
yes.
Good?
I'll go back and see one more patient tonight.
So,
wow.
Have a good evening, everyone.
It just occurred to me, we probably need to do an evaluation. At some point, I'm gonna go mention it to Terry, are you really nice to be a part of this? Okay, all right.
Which I get to leave the coach council job. Do a job that's coming to work.
Really nice.
I'm very hard of hearing. I'm so sorry. Oh, did you get it? Yeah. Okay, excellent. So I'll get it sent to you.
Thank you.
If you got any questions, just email me, okay?
In the spring or system, but I just her kids and I'm being proactive. So yeah, take her the way of the world. You gotta have everybody else up too.
We still have the former contemporaries that we used previously. Oh, okay, I can search back in my emails to make sure. Okay. If we do that, would be very helpful.
That's okay. But we do need to hear back. Hey, how's things? Overwhelming.
I'm not even so bad, so.
Oh, okay, all right.
Sure, you were retired now, aren't you? I'm not just San Francisco. Probably won't say San Diego. I don't think it'd be worse than San Francisco. I've been out there many times, years ago. It's a beautiful city. And now it's tragic what's happened to it. Yeah. It is. It's very unfortunate. So, well, I saw you in the courthouse. I'm still sleeping on it. You're a little bit older than me. What's your grade, 77? You got me by 5 years. I should be. I'm harder than you would, yeah.
But I get that, I do. So, anyway, it's hard. Let me give you, and it's just, it'll wear it under your head.
And then eventually they just delivery. And so we.
Yeah. I think there were, well, I had heard, not so much, so that there was a couple, or at least one, or something, so.
And they don't have to be in the charter, they just need to be present, because if you have been there, then let me help you with the next step.
No, I just didn't know she was.
Somebody's in there this time, there's somebody.
Yeah, that's interesting.
Still married to the same guy, but.
And the NICU where my grandbaby is, there's a woman who has a 7-year-old child that spent 7 months in the NICU. And she's a peer support specialist, but also works under lactation. So her higher job is she works with the lactation. Thank you. But she has spent hours with my daughter, just talking with her about the journey, how that child was trained and all of that. But we hired her the one time knowing she felt like sinners would be a wonderful job.
And even if you raise my hand,
Yes, do they require any training?
I don't think so. I don't know what, but I know that, one of the students with Zambia, she was working as a student nurse, and she was saying that sometimes we have to sit with people, and we can't do our job every time we sit. Yeah, so,
Which would be an interesting concept.
yeah, if they could hire sitters that had,
Yeah.
you know, some of your stuff.
Yeah.
There's always. So you might not be somebody that needs it, but it may be a woman that's just has dementia, so that somebody needs to sit with them in her hand, which if they're comfortable doing that.
Yeah, that's interesting.
Yeah, that's a thought.
Yeah, I know way to hire them.
Yeah,
Yeah.
that they actually.
Sorry, Marcus, I was saying, text me, it's over.
No, it's all good. Like I said, I'm just, I got on a call with some information, so we're good.
Thank you very, very much.
Yeah, no problem.
Bye, ladies. You're gonna be here in May.